I meet patients every single day that have never heard of the procedure that we've been performing in Atlanta for the past 25 years. So this isn't anything new or experimental or investigational. It's well proven. And I've had the privilege of caring for patients literally from around the world. We have seen patients at our center from every continent except Antarctica. Wow. So if you know anybody suffering with fibroids in Antarctica, I'd appreciate you sending them our way. That way we would have the globe. But since COVID, it's obviously been harder to treat patients coming from a distance, but Atlanta flies pretty much anywhere nonstop. So we use Atlanta and Delta as a hub and have treated, say, lots and lots of patients suffering with a condition called uterine fibroids. So there are some people probably here that don't know what a fibroid is. Anybody not know what a fibroid is? Wow, everybody knows. Okay, well, that's a good start. It is the most common pelvic tumor seen in women. It is a benign tumor, fortunately, benign, so it's not malignant, doesn't turn into cancer, but it can cause a lot of misery for a lot of patients. Now, there are some women that have fibroids. They don't have any symptoms, and we'll talk about symptoms in a moment. They don't need me. They don't need this procedure that I do called UFE, uterine fibroid embolization. We call those fibroids that are in the uterus that are not causing any symptoms passenger fibroids. They just ride along in the uterus and what doesn't bother the woman doesn't have to bother them, and they pass away with those fibroids and not having to do anything. And that's great. That's perfect. That's certainly less than the treatment I do. It's the least invasive thing. So not everybody needs treatment. That's an important thing to get up, start with. Now, what are the symptoms? There are some women that have significant symptoms from fibroids, and not to put Lavonda on the spot, but at some point she may want to share exactly. This is a total surprise that you're here. This was not arranged. You can vouch for that. But a very pleasant surprise nonetheless. The symptoms are, we call them the big three. Now there are multiple symptoms that you can get with fibroids, but there are three that are really kind of at the top of the list. The first is bleeding, heavy menstrual bleeding. It is the number one reason why women have abnormally heavy periods. And some women have been bleeding so heavily for so long, they think it's normal. And it's not normal. But it's like their normal, and their normal is absolutely not normal. So when I ask patients, what brings you here today? And they might say, well, I'm having a lot of pelvic pain, I'm having some urinary frequency, those are 2 and 3. But they didn't mention bleeding, and because she thinks it's normal, so she doesn't bring it up. So it's really important to know what abnormal is. If you change a pad more frequently than every 3 or 4 hours, or you need 2 at a time, or you can't sleep on your good linens at night or your girlfriend's couch, or because you're afraid of accidents, if you have to double up, or if you get episodes of blood kind of gushing out or flooding or clots, big, you can have little tiny clots, but I'm talking like quarter size or bigger. If you have blood just kind of come out suddenly and a lot, all of those things are abnormal, no matter how long you've been doing it. And it's surprising to me how physicians kind of just ignore like those simple things, because if it's not coming up as a low hemoglobin or hematocrit, that really to me doesn't matter. If it's bleeding enough that interferes with your quality of life, if you have to carry around a bag of clothes with you, or have to know where every bathroom is, or if you change so frequently, all that is abnormal and should be treated, and should talk to a physician about it. And see if this is fibroids, because fibroids are the number one reason why you would do that. They also cause pain. Fibroids, if you could feel them, and some women can feel them, it makes them look pregnant, particularly if the fibroids are at the front of the uterus. All of a sudden they're like, what is this? It feels like a rock. Well, if you could feel a fibroid, it is like a rock. It's made of smooth muscle and fibrous tissue, and it's absolutely hard to the touch. And a woman is, in general, soft and squishy, and this thing is hard, so it's easy to feel where this is. And it will just press on things. Being a rock, it can press on whatever it is next to. If it's near the lining of the uterus, and centrally, the uterus is hollow, like it has a cavity, if the lining, which is responsible for the period, if this fibroid is right up against the lining, What's going to be the main symptom? Heavy periods. If the fibroid is in the front of the uterus, what sits in front of the uterus? The bladder. And so it will compress it like a paperweight. And so the bladder, instead of being able to fill normally, it has this rock on top of it, and it can't fill very much before the woman feels like, I gotta go. Or she may even leak urine, but she's gotta go more frequently. It feels like her bladder is full to her, but it's not. It's very empty, and she races to the bathroom because she got the signal to go, and she empties very little. It's like, how could that be? It felt like I really had to go, and that's all the result? And she doesn't understand, she doesn't make the connection. So urinary frequency, waking up at night. She may pass her husband, has the large prostate, and they each kind of pass each other in the night. He's got to go more often because he's got an enlarged prostate, and she's got to go more often because of her fibroids. Pain. If it's along the lateral side walls of the uterus, there are pelvic nerves that cause pain in the abdomen and pelvis. It can radiate down the legs. That kind of pain is called sciatica, and that's usually from fibroids in the back of the uterus, and it presses on nerves just like if you were to throw your back out. Some people that might lift heavy furniture or something, all of a sudden it's like, oh my gosh, I got this electricity down my leg. It's the same pain. It's not due to something wrong with your back, it's your fibroids pressing on those pelvic nerves. And so we often see patients that have been to the chiropractor, and now the chiropractor gets imaging and sees an enlarged uterus, and if they know me, they'll often send them our way to take care of the fibroids, because it's not a low back problem at that point. Same with constipation. That's another symptom that patients don't realize and physicians don't realize. They have a patient with constipation, and so they'll immediately knee-jerk that patient to GI. And they get this mega GI workup, and it's all normal. And the problem is, there's a big fibroid in the back of the uterus because the colon sits right behind the uterus and it presses on it, same thing. And so you need to get your fibroids treated. It has nothing to do with your GI tract. Well, what are some of the treatments for fibroids? If you know you have a fibroid, you know you have symptoms, there is a wide spectrum of treatment options. The least invasive is what I mentioned earlier, nothing. It's called watchful waiting. And a lot of the gynecologists will talk to patients about, well, your symptoms don't seem to be that significant. We'll just kind of watch it. We did an ultrasound, we saw these things, but for right now, we're gonna do watchful waiting. Or the next phase up is they'll place patients on medication for the symptoms. Most commonly, it's birth control pills. Now, nobody knows where fibroids come from. However, once they arrive on the scene, there's no question they grow with estrogen. And so we want to employ an anti-estrogenic approach. So women that are placed on birth control pills doesn't make a lot of sense. Now, it will lighten your flow, and if your main symptom is heavy bleeding and you're placed on birth control, oftentimes your periods will get lighter. But in the background, it's like pouring gas on the fire to those fibroids. And those fibroids will grow much more rapidly than they normally otherwise would. And so the birth control will work for a little while and lighten a woman's periods, but all of a sudden, that extra growth of the fibroids will overwhelm the ability for that to work any longer. And now they go back to the gynecologist, and the gynecologist says, okay, we tried the less invasive approach, time for surgery. And there are two flavors of surgery, and it depends entirely 100% on if a woman is interested in fertility or not. If a woman has either a definite or possible interest in fertility, the surgical choice is myomectomy. If she doesn't have any interest in fertility, hysterectomy. A few thoughts about hysterectomy. It is one of the most unnecessary, if not the most unnecessary procedure that we perform surgically in the United States. It is the second most common surgical procedure we do in the United States. Let that sink in for a moment. It is the number 2, the second most common surgery we've done in the United States, and yet, and I know my office staff think I have a uterus, I don't, half the population has no uterus, men. And yet, we're number 2, really? And And the most common reason why we do hysterectomy is not cancer, which would be absolutely appropriate. It's for these benign tumors. The average age of hysterectomy in this country, 39. So these are young women, and in my almost 30 years of caring for patients, 25 years of embolizing fibroids, I have seen way too many young women, less than 30, have already had a hysterectomy for these benign tumors. It's a tragedy. In fact, I was speaking at Tuskegee, speaking of Alabama, and 3 women came up to me afterwards crying after my talk there, all less than 30. All of them had hysterectomy for fibroids. None of them wanted it, none of them, but they kept getting the same thing told to them. You have to have hysterectomy, you have to have hysterectomy, that's it. And they were suffering so badly, I get it, they were suffering. They finally said, okay, you win. And they lost. Because there is a tremendous procedure I'll get to in a moment, this UFE procedure. It's one of the biggest medical breakthroughs for women, particularly women of color who disproportionately suffer with these benign tumors. But every day, 3,000 women lose their uterus for fibroids. And we got to put a stop to that. It's been my life's work. I will talk, and my wife will verify this, I will speak to anyone that will listen. It's just so important. Women are entitled to know all of their options, whether the surgeon does them or not. They're entitled to know all their options, not just telling them the surgical choices. Now, the other choice, myomectomy, they surgically cut into a woman. They surgically try to get out as many of the fibroids surgically as they can and sew the uterus back together and then sew the woman back together. They leave almost every woman I've ever seen that has undergone a myomectomy, they leave them with the impression that they take every single fibroid out of the uterus. And that is just an absolute falsehood. I hate when I say a lie, but it's a lie. I mean, they often leave as many fibroids in the uterus as have been taken out. At least in women that I've seen in my practice, the typical patient has numerous fibroids in their uterus. I've had the unfortunate thing of seeing a woman that's had 5 myomectomies, and now she's coming to me for procedure number 6. A woman can have 1 myomectomy. This is my opinion. She can have 1, because if 1 takes care of it, okay, fine. But as soon as it doesn't take care of it, in my opinion, all of those patients should go to UFE. Because there shouldn't be this continued, because the other thing that they don't mention to patients is every time you surgically cut on a uterus, the fertility diminishes. And so after 1 myomectomy, there's about a 50% chance of having a child. After 2, probably about 10%. With UFE, the fertility rates are comparable. 60% of our patients that wanted children have gotten children after UFE, which I think it's certainly comparable to myomectomy, every bit as good as that. And our patients are older in general. They're usually 35 to 45, the ones that are trying for fertility. So they're older than the typical fertility patients. And they've often had some kind of procedure, whether it's Accessa or myomectomy, or a lot of them already had something done which has diminished their fertility before they even got to us. Okay, UFE. UFE is an outpatient, non-surgical procedure to treat fibroids. It treats every single fibroid in the uterus, all of them, whether you have 1 or 100. Doesn't matter if they're 2 centimeters, 1 centimeter, 10 centimeters. I've heard lots of things from patients say, well, I went to my doctor and they said I had too many fibroids for UFE to work. That's just ridiculous. Or it's too big for it to work. That's ridiculous. Never too big, never too many. You've got to talk to patients and you've got to explain, the expectations. But almost every single patient that's a surgical patient is a patient for UFE. There are some exceptions. There are some very unusual circumstances. But that's why you got to go have a consultation, get an MRI, and talk to somebody that is experienced in doing UFE. Our patients come into the center. Somebody brings them. The procedure takes me about 30 minutes, pretty quick. They sleep through it, but they're not put to sleep like an operation. The sedation is IV and local. It's much nicer, no general anesthesia. There's a brief recovery in our center, several hours, and they go home with a Band-Aid right there. Band-Aid, that's it. Recovery about 5 days. They're out of work maybe a week at most. And then I see them in 3 months to make sure that the symptoms are at least significantly better or gone, and the fibroids are dead. 90% of patients will have that, and they'll get their life back. It's transformational from someone who's had horrific symptoms, now has their life back, and doesn't have to worry about everything revolving around their period. Everything that they had done, it was where they were in their cycle. Whether they worked or not, a couple days of work, maybe they don't go to work. Whether they have relations or not, whether they are able to go out at all, whether they socialize, whatever they do is revolved around that ridiculous period. And with UFE, you get your life back. It is absolutely a phenomenal procedure that everyone is entitled to know about. And so if you take one nugget from this, no matter what your doctor tells you, you should seek, if you're suffering with fibroids, you should seek a second opinion, just to see, no matter what they say. Get that second opinion, because, as I say, I've heard a lot of people say, well, they told me, I brought it up, but they said I wasn't a candidate for whatever reason. And that's just simply, for the most part, simply ridiculous. So if you're suffering with fibroids, or if you know somebody suffering with fibroids, we would be happy to talk to them. As I say, we see patients from all over, because unfortunately, most women never hear about this information. And I want to change that. We've been trying to work at a national level. We have a documentary coming out that I hope, we pitched it at the Toronto International Film Festival last week, that somebody from Netflix or HBO will take this, because this should be a national conversation. Women need to talk to each other. Sometimes this subject is embarrassing. They don't want to talk about periods. I have so many patients tell me, it wasn't until I was in the throes of this and I asked my mom, she said, oh yeah, I had a hysterectomy. I never knew that. I never knew till I was in the middle of it and asked her about what I should do. She then tells me, that shouldn't happen. Women need to talk to each other, mother, daughter, sisters, friends, sororities. Get this information out, because you do not need to have surgery. Open surgery, open hysterectomy, because these uteruses are often very big. If they go above the belly button, which is not an unusual thing, the surgery is cutting them from breastbone to pubic hairline vertically. That's what they get. Or if it's around the belly button or smaller or lower, they'll get a hip-to-hip horizontal C-section like scar. Or they may start horizontally and realize, we can't get quite enough exposure. Zip, now you got the upside-down T. Horrific, big-time surgery. I give them a Band-Aid, a government issue Band-Aid. That is it. So with that, I'm going to stop. I'm getting the cut it hook from my wife. So I'll be happy to answer any questions that you might have, but I really appreciate your attention, and please get that second opinion.
I just wanted to share real quickly, and feel free to ask me questions, because I did receive the procedure. It's been about 7 or 8 years ago. I think I was 40-ish when I had the procedure. And I did everything that he said. You would almost think it happened to him. He's very passionate about it. That was one of the things that I was drawn to when I researched and found him. Like he said, this was not planned. I actually saw it on Facebook, and I saw him, and I've been thinking about my life the way it is now, and reflecting back. I was trying to figure out what was different, because I'm traveling now, I'm going to events and doing different things that I haven't done pretty much throughout my adult life. And what I realized was I just didn't feel well, and so it led me back to my fibroid journey, and how much better I feel now 7, 8 years later. So that's just a brief synopsis of my experience. Like I said, I just wanted to personally thank him for giving me my life back, because truly that's what it was. Traveling, spending the night with people just wasn't gonna happen, because I was always worried about having an accident. I had them at work and different things like that. So again, Dr. Lipman, thank you.